So we're going to talk a little bit now about the basics of CBT theory, which underpins a lot of the way that we work actually in CBT. So Adam, could you start by telling us a little bit about that theory?
Yeah. The basic theory is that we can think about human beings as operating in several different domains, or we can do what we would call a case conceptualization or a problem conceptualization by focusing on the different domains that in a sense, sum a person up. So the thing that people are most focused on, probably when they come for therapy, is often the feeling domain, the emotional domain. That's often what people present with. I feel depressed, and that's the problem. So feelings are one domain. Another domain is the physical sensations, what's happening in people's bodies, which often relates to their experience of arousal or non-arousal of flatness. So you either get the effects of the fight-flight mechanism or the feeling of being flat with depression and not having much happening. We also have the domain of behaviour, what people are doing, acting, how their movements are happening, what they're doing in their behaviour. And then the final domain is the one of thoughts, what people are thinking. And we distinguish between thoughts and emotions very simply by saying that if you can say what you're feeling in a single word, that's an emotion. It's a good distinction. And if when you say to somebody, what are you feeling, they say, well, I'm thinking that so-and-so is doing this, that and the other, that's definitely a thought. You're using several words. And then what we do in CBT is we try and bring these four areas into relationship with one another. When you do this behaviour, what are you feeling at the time? When you're feeling that, what are the thoughts? When you're having those thoughts, what are the experiences in your body? And then the fifth area is, what's the context in which all of this is happening? What's happening in your family or in the workplace environment or in the space where you're having these experiences? Right. And how does that affect these different elements? And we'll try and draw a simple diagram very often to draw a pattern. What did you think at that moment? What did that make you feel? What did that feeling make you do? Or vice versa. Trying to find relationships. So that's the simplest way of stating the theory. That's the basic analysis.
Right. So you've got those 5 areas. You've got the personal experience within kind of a situation or a context that that's occurring. It sounds like you're breaking it down into each of those parts to really help someone see that there are different parts, I guess.
Yeah, it's amazing how just that simple understanding then allows people to make sense of their experience. And once you pay attention and break it down into those areas, it suddenly becomes more manageable. And I think another important thing which people have a lot of difficulty understanding very often is that feelings are different to how people think of them in everyday life very often. We think of them differently in CBT. So one of the ideas in CBT is that we don't carry around feelings. We make feelings in the moment we experience them. So we're not carrying feelings from childhood. We are carrying thought processes, or ways we learn to think, which generate the feelings. And we may have learned those thought processes some time ago, but we're not carrying around the emotion from that time, we're carrying around the thought from that time. And when we have the thought, that makes us have the feeling. It's not as if there's a pool of emotion inside us which is waiting to be expressed. There are a number of thought processes which are triggered off, and then we have the feeling.
So what implications do you think that has for the work that you might do, or the focus of the work?
Well, as I say, generally people quite often people bring feelings and want to change feelings, but we tend to say, or I tend to say to clients, you're not very likely to change the feeling directly. The only way we know of changing feelings directly would be to take medication, which isn't something we offer in CBT, that's the realm of medics. And if you take medication to change feelings, it will tend to have a global effect on all of your emotional experience. So although you bring feelings very often as something you want to change, that's not where we do the work. Where we focus on is changing thoughts and changing behaviours usually, and sometimes planning to change the context in which you are. And by changing those things, then we'll change your emotional state. Right. So it's then uncoupling and working out how we might do that. That we do in the process of therapy. And then people will often say, but my feelings are true. and they seem to, I think what they're implying then is somehow they're right. Well, this happens and then I feel that, I can't help myself. And of course this is where we say, well no, your feelings tend very often to follow on from your thought processes. And your thought processes are not a given of a situation. A situation is not inherently frustrating or sad or anything else. It's the way you interpret it. So you look at a situation and you think about it, and then you make decisions about how you feel about it, and then you have the emotion. That's the usual process.
Right.
And you can change what you think about a situation. You can see it differently.
Mm.
And that's what a lot of CBT is. It's about persuading people to persuade themselves to see things in a less upsetting way.
Mm. So you're identifying interpretation, meaning, and thinking about maybe kind of how accurate or helpful that is to a person in terms of how it affects them emotionally, whether it's helping them kind of adapt and cope to whatever comes up in their lives.
Yeah, and we'll often say to people, is that the best, we'll make it quite explicit, we'll say, is that the best way of thinking about the situation? Is there another way of looking at it? Would somebody else look at it differently?
Mm-hmm.
At other times of your life, would you have looked at it differently? Can you look at it differently now?
Mm.
And of course what we know is that when people have periods of upsetness in their lives, particularly anxiety, it actually changes their emotional state and their thought processes. So they're much more inclined to be threat focused, and so their thought processes will tend to be darker, more negative, seeing dangers when they might not have done at other times in their life, seeing things in terms of adversity and problems rather than opportunities. And it is possible to argue yourself out of that position and de-escalate down to a more balanced way of looking at things.
So what might you say to somebody who would ask you, if I change the way that I think, will that directly change my behaviour?
If I change the way I think, will it change my behaviour? Well, I suppose it would depend on what thoughts you were changing, but I think we certainly would get people to change their behaviour as well as their thoughts, and sometimes we focus more on behaviour. It depends on the problem formulation, and it depends on how the person is, how they think about things, to whether we go for a behavioural change or a thought change. And again, that will be negotiated with the client. And if we go for a behavioural change, quite often what we'll say is, well, I wonder if it would make a difference if you just counted to 10, took some time out, acted in a more assertive way, said no, all sorts of different interventions. And rather than saying to people, well, why don't you try that, we're more inclined to say, well, why don't you try that for a while and see whether that makes a difference. So we've got this idea about doing experiments. So we suggest to people, well, you go and try that. Maybe you might even try it on one day and then not the next day, on alternate days, and see if you get better off. Or you're better off on some days than the others to do an experiment. So we get people to change their behaviour as well as their thoughts. And another important thing to say about feeling states, perhaps, that we should have mentioned, is that people are not always very good at saying what their feelings are, and it's quite important sometimes to spend a bit of time thinking about how you feel, what is this feeling, and actually naming it.
Yeah.
And often we can derive or make good guesses about what the underlying thought processes are if we know what the feeling is, if we've got a handle on the feeling. And clients often make quite fine distinctions. I'll say to them, so do you feel angry? And they say, no, I'm not angry, I just feel frustrated. And it takes a bit of time to tease out what they mean, what the difference is. So I think the early stages of therapy are very much about spending a lot of time focusing on what's actually happening and being very clear about that, rather than jumping to conclusions and moving towards treatment too soon.
And I guess there's some very kind of simple themes to hold in mind with different kind of basic emotions, aren't there? So fear is about threat, and anger is about blaming, or that there's been an injustice in some way, or guilt is about a sense of having done something wrong.
Yeah, absolutely. So we a good therapist will be able to pull out and elicit from the client and help the client to find the implicit meanings in what they're saying, and that's about effective questioning, really. It's about just exploring a little bit, and often what we need to do within that exploring phase is generate some of the emotion in the session to get access to the thought processes, because thoughts and feelings are very closely linked, and the way our brains work is by association. So often in the calmness of the therapy session, when people are talking about anger or guilt or sadness, they can't tell you what they're thinking when they last had those emotions, except if you get them to experience some of that emotion in the session.
Right.
So you do a little bit of reliving, you get people to close their eyes or remember a conversation or the last time they had that feeling, and then you ask the questions, and you find people get access to a lot more information there.
Okay, I think that's described the model quite well there. Is there anything else you want to add?
Only I think we should say something about what direction of change we're looking for, because it might sound as though we're just persuading people to be, I think the expression is Pollyanna-ish, to always look on the bright side, to always be cheerful. And that's not what we're saying. What we're saying is that we want people to adjust their thought processes so they're more in line with an adaptive view of reality. So it's no good thinking everything is marvellous. In fact, there's some evidence that some people who get depressed tend to think that things are marvellous when they're not, and then they get knocked back because they're over-optimistic. So what we're trying to do with the changes in the thought processes is get people to assess things more realistically, to have an accurate sense of probability and how likely it is that things are going to turn out well, and a more stoic view on when things turn out badly, to be able to say, well, it didn't go as I wanted, but I can live with that, I can tolerate discomfort or pain or frustration. I'm not going to pretend it's good, but it does. I don't need to also overstate it and say it's terrible, it's awful, I can't cope with it anymore. Okay. So it's about getting a balanced view.
Okay, yeah, that's helpful. So hopefully you've got a better understanding of what the CBT theory is and how it works. And in a session you can get an even better understanding of that once you start to bring in your own experiences and hang it on this particular model.